you are obviously a medical doctor. What is the best way going forward to get a single payer in this country? Most countries have that, and we need it too.
Exactly. We need it, and we can afford it, in fact, because it doesn't cost any more than what we are paying right now. It simply ensures that our healthcare dollars are paying for healthcare, not for health profiteering. We need a healthcare system that is established for people, not for making profit. So again, this is all a matter of achieving critical mass. We need to come together as the many movements we are for health justice, for climate justice, for racial and economic and LGBT justice, and women's justice. When we get together with the courage of our convictions, we're unstoppable.
Hello, this is Nice Wonder. Welcome to the NOWMAN Show. Medicare For All, also known as single payer option, would create a new government-run national health care insurance program to replace the Affordable Care Act coverage, otherwise known as Obamacare. Now, in California, there is a movement to put Medicare for All single payer on the table, a universal national healthcare system that covers all Americans and has become one of the many convergence issues bringing people together. Today we are joined by two guests, Kenneth Meija, the Green Party candidate who is running for U.S. Congress in the election of 2018, representing the 34th District here in Los Angeles, and Jenni Chang, who is a Medicare for All grassroots activist. Welcome to the NOWMAN Show.
Thanks for having us.
Kenneth, now you're obviously, as you saw there, that's the Green Party's presidential candidate from 2012 and 2016. And this is a big part of the Green Party platform, and it's also a coalition issue. First of all, tell us a little bit about yourself and what you're doing and out there on the ground.
Right, so my name is Kenneth Meija. I'm a 26-year-old representing the Green Party running in the April 4th, 2017 special election.
Ah, okay.
And, you know, what we're doing on the ground is we're educating people, you know, on the issues that matter to them, you know, like Medicare for All, for example. And so we're reaching out to different organizations, different coalitions, you know, knocking on doors to let them know about, you know, you could fight for something better, which is single payer. So a lot of grassroots work.
That's fantastic. So, Jenni.
Hi.
Hi. You do a lot of coalition work, bringing groups together. Tell us a little bit about yourself.
Well, I'm with two groups, Progressive Action for Glendale. I was born out of the Glendale for Bernie movement. Glendale for Bernie group during the primaries.
Yeah.
And another group is Progressive Asian Network for Action. And
Great.
both groups are working on pushing Medicare for All. We are working with California Nurses Association, which is part of a larger coalition known as Campaign for Healthy California. That's an organization of 60-plus groups just pushing for a single payer, and they just partnered with another coalition known as All Care Alliance, another group, many groups, like you've got social advocacy groups, businesses, healthcare groups, all pushing for this bill, which is now drafted, and they have an author.
So it is an actual bill being submitted in Sacramento.
Right.
Do you know what date that is?
I think the public rollout will be February 20th or so, February 22nd, somewhere in this month.
So after, that'll be, our show will be airing after that time, but, so that is coming right up. So that's fantastic.
There's a lot of urgency and excitement.
So in general, California leads the way, usually in progressive change. So the Green Party is kind of like the main focus right now, right, as far as progressive change is concerned. Is that correct? I mean, what is it like down there on the ground? What kind of response are you getting from people?
Yeah, so when we're talking to people, it's actually, we're getting great responses. You know, in LA, I think people are sort of sick and tired of getting ignored by their elected officials, whether it be city council, state, or federal level, and they see it's both the two-party system. But when we talk to them and we say, hey, we're from the Green Party, we're actually here fighting for you against gentrification or for health insurance, they're like, oh my goodness, I only thought it was Democrats and Republicans. And I'm like, no, there's us. And they're really receptive to it, because I think the community now is what they're seeing in the past election cycle going on right now. They're sick and tired of it.
Yes.
And this is the perfect moment for coalition building. And that's what we're doing. So they love it. They're receptive. So, yeah.
Yeah, and what's interesting is that, you know, many countries around the country have not only had single payer for a while, they've had it for decades.
Right.
I mean, even countries like Saudi Arabia and Israel have had some kind of a national single payer healthcare program for decades. We are the richest country in the world, and maybe both of you can respond to this question, like, we're the richest country in the world, why can't we get a national plan like that here?
Do you want to take a stab at this? I mean, our government is beholden to special interests. We've got insurance companies, pharmaceutical companies. I mean, when you have pharmaceutical CEOs making the highest pay of any CEOs of any industry, and this is healthcare, the battle's going to be really hard. This is not a fight we can't win. We just need people galvanized and educated and coming into the fold. That's what it's going to take, and that's why I'm always saying this is bigger than any candidate. This is going to take the people. It's going to take it's going to take all of us educating each other and doing grassroots outreach and not just talking to each other.
That's right, but it starts with conversation. It starts with meeting people, as you know, as you do on the ground, as you do connecting with the Nurses Association. I believe that we were talking earlier. You said there was 60 plus advocacy groups out there.
Oh, right.
Wow.
There's a lot of labor movement.
I mean, and it's growing, right?
Right.
And I'm looking. I want to mention a statistic here. I've looked at a couple of statistics here. There was a Gallup poll, and this has been pretty consistent. 58% nationwide are in favor of a single-payer program. There's a group called Progressive Change Institute. 13% in their poll opposed it. Just as recent as February of 2016, Kaiser did a poll with a 64% positive reaction towards single payer. So the fact that people want this and we can't get this, obviously it's a political economic issue. People want to make profits off of healthcare, and one of the things of the Green Party we're going to get into in discussing politics in another segment is, you know, their platform is over profit, peace, people, over profit. So what is, in your advocacy and education of people, Jenni, what are you doing to educate people about what this means, even in a fundamental level, let alone going into details?
Yeah, fundamental level. Like, we have people who've never been politically active come into the fold, so then they want to know the difference between, like, why do I need to fight for Medicare? What is it exactly? And then what is single payer? So we have to break that down. I have to explain that we would... Do
you distinguish between Affordable Care Act and Medicare for All when you educate people?
Well, so like with Affordable Care Act, some people don't know that it's the same thing as Obamacare.
Yes, or Romney Care.
Or, yeah, sure. We got lots of insured people in Massachusetts.
Yes, that's right.
The most of any state in this country. So, I mean, we have to straighten these things out and let people know that this is a good thing. And we really have to emphasize this concept of no insurance is weird to a lot of people. And so we have to say, look, they're creating obstacles. They're raising deductibles, so you can't even afford preventative care, like you don't even bother going to the doctor. We talk about access. They're preventing access. They don't want, these insurance companies, they don't want you going to the doctor, and also they're fighting back. Like, when you go to a doctor, they're constantly fighting, the administrative people at the doctor's office are fighting with your insurance companies to cover things that you need. I hear from doctors' offices all the time, like, working with Medicare is a lot easier than dealing with insurance companies, because there's so many insurance companies, so many different types of patients, there's so many different plans. It's
that
a headache.
Alone,
it's
right?
Bloated.
Let alone the profit. That's a good point. Let alone the profit aspect. There's also the interconnecting of all the different sources, you know, to try to get everybody on the same page. We're actually running out of time, but I want to real quick, if you have a closing comment you want to make, and we can pick up on this conversation because this is an ongoing conversation. What would you like to say in closing about this, and not only this issue, but how this is bringing people together as we go forward? Start with you, Kenneth.
Right, so, you know, what we need to do is we need to get people involved, and they need to become politically educated more than just voting. You know, when I talk to people on the ground, I tell them 29 million people are uninsured and 33
Yes.
million are actually underinsured. And in Los Angeles, 1 out of every 5 people don't have health insurance.
Oh my gosh.
And then we tell them the fact that we're the only major country that doesn't provide health insurance. Like, oh, I didn't know that. So I think it's going to be educating people and then telling them, you know, once you're educated on it, tell your family, tell your friends, and then we're going to get your contact info, and then we're going to let you know when the plan of action calls, which is when we work with groups like Jenni's groups and the Campaign for Healthy California. So I love coalition building and building movements with people. And that's sort of
Fantastic.
what we
I see
did.
your passion. And we can find you on Facebook, right?
Right, Kenneth Meija for Congress, M-E-J-I-A.
Excellent. And Jenni?
Those of you new to this fight, I would say this is not a new fight. The majority of the people in the state want it. They have wanted it. It's been in the legislature a number of times, either to die in the Senate or get vetoed twice by Schwarzenegger.
Yep.
We have to fight. We have to know that this is the most expensive place in the world to get sick. Please join this campaign for Healthy California. They are the ones pushing to make this bill pass. You can easily sign up for the campaign, may I?
Great.
Just text Healthy California to 69866, and you can sign up for updates to come to rallies and get notifications on progress of the bill. Join us.
Thank you very much, Kenneth Meija and Jenni
Chang.
Chang. Thank you for being on the Now Man Show. To be continued. This is Nice Wonder, and you're watching the Now Man Show.